Good morning, everybody. You're very welcome today, joining us on the County Wexford Chamber in conjunction with SomarMed and Dr. Shane Farrelly, CEO of SomarMed. Dr. Farrelly is a well-respected, highly experienced and very influential occupational health therapist with his own business and also on various boards, including consulting with the HSA. I'm delighted to say that Dr. Farrelly has offered to give us a very timely presentation today around the challenges which we will all face around reopening our economy and returning to work and supporting the mental health of our team during that and planning a phased return to the workplace. I'd like to welcome Dr. Farrelly to join us now, and from time to time I will be assisting Dr. Farrelly in terms of, we'll do some interactive polls, and questions are welcome. Please input them there on the question and answers tab. Thank you. Thank you. Thank you, Shane.
Okay, thank you very much, Fiona. And I would like to thank Fiona and the County Wexford Chamber for inviting me along to present today. Of course, this is all very new to all of us. And we are all actually sort of learning as we go, but hopefully I've got something to add to give you more value. So the first thing maybe to look about in here in a way of an introduction in relation to this is potentially sort of an overview of where we are, and a little bit about myself. So first of all, I suppose in relation to me, I'm an occupational health specialist, and many of you, your only interaction potentially with an occupational health specialist has really around being absence management and supporting your colleagues back into work after they've been off work with a complex history of illness. But a significant component of what we do is working in conjunction with our environmental health and safety colleagues to help ensure that the work environment is safe. So what we have to do is basically work with EHS, work with the board, and provide and help in the provision of protocols to ensure that the work is a safe place to return to. And our ethos is that everybody goes home safe. So as you could imagine, COVID-19, of course, completely fits into that particular remit. I think, first of all, to give a bit of introduction, I think it's important that what we talk about here is focus on the positivity. We've actually come through essentially a 2-month period with a lot of negativity. The economy has been completely impacted, but we're now moving forward. And I do really think that the Irish government have actually taken a very good approach, basically, to this. I know there is a little bit of backwards and forwards between the Chief Medical Officer and the Taoiseach, Leo Varadkar, at the moment. But of course, when I would look at this from the point of view of a risk assessment or risk evaluation, Leo has to ensure that we protect the mental health and get people back to work. Whereas, of course, the Chief Medical Officer's focus is absolutely on basically protecting the public health. But I think both are absolutely possible to do. Just coming back to that particular point, there has been a lot of talk basically in the past too around the issue about the potential claims, and in relation to that, I actually had the opportunity to join a very excellent presentation by Adrian Toomey last week when he was talking about that particular point. In other words, what you can do to actually hopefully help and protect yourself. And I do understand that Adrian is actually doing a further basically a webinar on Friday, which I do feel be well worthwhile listening to. And I understand that Fiona can make both last week's webinar available and of course obviously on Fridays basically as well. An interesting point what gets a lot of headlines is the fact that particularly in the NHS, that tragically healthcare workers have actually died from being exposed to COVID-19 through their work. And whereas I'm not going to touch on the legal aspect, it's worth noting that if we actually go back in 2014, when there was basically the outbreak of Ebola in West Africa, and health professionals from both Ireland and the UK went to render assistance, there were no healthcare professional deaths during that time. The second, which is probably more relevant, is excuse my pronunciation, but Cotuno, which is a hospital near Naples and became a designated COVID-19 hospital, which it still is, because they have put in place protocols, appropriate PPE, and most importantly, risk assessment. There have been no staff deaths in that particular area as well. So it shows the importance of actually looking forward in relation to our risk assessments and the importance of that. Now, I know from having reviewed our particular audience as well, that we've actually got a very good cross section as coming here from both the hotel industry, construction. The construction, they must be complemented on the information they put together about returning to workplace. And in one of my templates at the very end, I will actually reference that so you can actually download that. I also know we've got people from transport, from industry, basically from the hairdressing and dental community. Dental community particularly challenging because of the aerosol spread. So it's good to have a wide range of people, and hopefully the polling system will give us indications to where everything is as we go forward. And as Fiona mentioned, this is important to have this interreactive, so question and answers, either as we go or at the end of the session. I'm going to break this up into two parts. The first part about preparing to go back to the workplace, and the second part about mental health, because the second part really seems to follow through quite well from the point of view of that. I think one of the parts to actually reference here, as a question I get frequently asked, has been about the question of herd immunity. And I know in the very beginning there was a suggestion that, particularly in the UK, that herd immunity might actually be a preventative measure, which of course it's not. Just to give a little example in relation to that, and I think a good example of that is in relation to mumps. So herd immunity only works when combined with a vaccine. So therefore herd immunity can't be considered for COVID-19 until a vaccine becomes available, and that's in the region of 12 to 18 months down the road. But if I give an example about mumps, so we all have talked or hear about the reproductive rate, or the RO. And mumps has a reproductive rate of 10 to 12, which means it's significantly more infectious than COVID-19, which has a rate of 3 to 4. But if we actually talk about this in relation to herd immunity, without vaccination, roughly 95% of the population would require to get infected, because 5% of the population would appear to actually have a form of inbuilt immunity. Now, for mumps, you need 92% of the population to be immune for the disease to stop spreading entirely. And in relation to COVID-19, if you actually go with the multiplier, taking its RO level of being 3, then you're talking about that you'd need 70% of the entire population in order to instill herd immunity, which is what you're looking at through vaccination. And of course, to give a sense as to really why herd immunity couldn't be considered a preventative measure, because you're talking about, well, COVID-19, infection fatality rates, of course, vary, and they're talking about it, particularly if you can have access to ICU, they're still running at between 0.5 and 1%. So, of course, in simple maths, if 70% of the entire population got sick, that would mean that between 0.35 and 0.7% of everyone in the country would die, which, of course, would be a completely catastrophic outcome. The second question that's coming up more and more to the forefront, and particularly in relation to the returning to work, is in relation to face masks. So I thought it'd be important to give a reference of that. And this is really relating to asymptomatic cases. So asymptomatic case, as it would suggest, is that a person who's absolutely got no symptom whatsoever at this point in time, but can pass it on to somebody else. And the criteria in relation to what if a person is asymptomatic relates to the stage of the infection they're in, which could be anywhere between 2 and 14 days before they develop symptoms, or it relate to the virus load, or indeed it will relate to their underlying immunity, and indeed basically to their age. Initially, they were thinking that the asymptomatic population could at any one point in time be as high as 25%. And the general advice about basic face masks, and I think it's important to utilize Leo Bradford's term, instead of utilizing face mask, to utilize the term face cloth, which is a combination maybe of cotton with some kitchen towel on the inside of, which is a lot of very good ways you can do this in the internet, so you don't utilize all the face masks, the surgical masks, away from the frontline workers. But it was thought that people were probably not going to apply them properly. And indeed, when you're out and about, of course, if you don't cover the nose and the mouth, is of no value. And of course, you go to the supermarket and you find people are not wearing it adequately. But the other thing is, of course, it is known that the face mask is not going to protect you from contracting COVID-19 from somebody else. But what it is going to do is prevent you, if you have it, from spreading to somebody else. Now, a survey that's just been completed on the 3rd of May in India revealed that basically that more than um, the level they actually had in relation to that who actually were noted to be asymptomatic was in the region between 50 and 82%, so significantly higher. And in relation to a study that was completed in Seattle on the 27th of April, they found that over 50%, 50.8% of the residents of a Seattle nursing home had no symptoms, but they did test positive for COVID-19. So I do think there's probably going to be an indication where if people are going to be inside that social distancing area, there probably will ultimately be a recommendation that some form of face cloth protection is worthwhile actually utilizing. Now, as you see then basically there from the overview, what we're hoping to look at discussing today is the overview of the current status of COVID-19 in Ireland, outline the WHO criteria that the HSE have put in place to consider to relax basic restrictions, Ireland's 5-stage lockdown exit plan, guidance on how to prepare for reopening your business. And the second component of the talk is identifying the mental health concerns amongst your team at an early stage and providing appropriate support, and then also protecting your own mental health and that basically of your employees. So if I maybe move on, first of all, Fiona, if you wouldn't mind then to the overview of the current situation. So this is the situation as of yesterday. So we're talking about that there is, 16 new deaths and 266 new confirmed cases. And that means that there's been 21,772 cases of COVID-19 in Ireland. And tragically, the number of deaths to date has been 1,319. We're talking about the replication factor. Before, they were talking about that being between 0.7 and 1. Currently, they're thinking is probably more between 0.5 and 0.7. The importance, of course, of the replication factor, and people, of course, be very au fait with this now at the moment, is it means that the probability if one person has it of infecting somebody else. And when you're talking about a rate being around about 0.7, they will say if that stay at that level, that you're talking about not having any community spread. And of course, that's why you're giving consideration to easing the restrictions. I think to put this into a degree of relevance is that 2 weeks ago, and of course, 2 weeks is a very long time in the history of COVID-19. But as Dr. Moran, in conjunction with the Imperial College in the UK, carried out a study, and at that point in time, she thought that between 6.5 and 16.7% of the population in Ireland had actually become infected with COVID-19. That's one consideration. The other consideration is that we really just don't know if you get COVID-19, does that mean that you won't get it a second time? If you do have a degree of immunity, how long will that level of immunity last for? As Fiona mentioned, I'm an international occupational health physician, as such gives support basically to organizations across the globe, particularly around LATAM and the Americas as well as Europe. And when, in consultation with basically Philips or P66 in the UK, they're looking at getting their people back to work, and they decided to go down the road of utilizing antibody titer testing. But the one thing they did say, and the caveat they put, is that it's a volunteer process, but they were suggesting that if you had the correct immune status, your IgM and IgG, that you were potentially immune. But you've got to understand that even though that has been FAA approved, it's done so in an emergency setting, and the information to date would suggest that it's about 40% inaccurate. So A, it's going to get the test wrong on a significant amount of people, and secondly, we still don't know if an antibody test will indicate immunity. I know Chile have gone down the road of immunity passports, etc. So we have to wait and see what will happen on that. I do think in the future, antibody testing, when more information be put about that, is a way forward. Also, I think what's important is treatments, and they've been talking about a variety of treatments. Maybe a treatment would actually become available within a 6-month window. That would be fantastic, because it would mean that you could let more people out in the community if you had treatment for the elderly people. But you really must focus on preventing the spread basically of the illness. So as we know, in the beginning, the reproductive factor in Ireland had been getting close to 4 at the beginning of the crisis, which is so short time ago, really, a little over 2 months ago. And now, as you mentioned, down to potentially 0.7. So COVID-19 basically has reached a plateau, and people would suggest in the current situation that the growth rate has slowed close to 0. Important information too about the recovery time for COVID-19. Mild cases, the median time from the onset to clinical recovery is 2 weeks. Severe or critical cases, recovery time 3 to 6 weeks. And when I put this together as recently as yesterday, I was talking about 25 to 50% of cases may be asymptomatic, but we now understand from India that can actually go up to as high as 82%. So if you wouldn't mind, Fiona, going on to the next slide. So here we're looking at basically the six criteria that basically WHO have put in place for the lifting of the restrictions in a phased basis. And of course, do be very much aware on the importance of us all making certain that we do our very best to minimize the spread of COVID whilst getting back into the workplace is that Leo Varadkar and his colleagues have very definitely stated that should our numbers go up, we'll go back a stage. So the first thing they talk about is transmission of the virus basically under control. And what you're talking about in that particular aspect is, I think it's fair to say that with our current social distancing, we hit that criteria. The second part is the healthcare system equipped to detect, test, isolate, and treat every case and trace every person who came into contact with a positive case? We understand that to achieve this, the Irish government needs, through the HSE, to have the capacity of testing 100,000 people every week. When Leo Varadkar had the conversation before the May Bank holiday weekend, they were in a situation where their capacity was 70,000 per week. So correctly, they held off until the 18th to start actually easing the restrictions. The importance of the detection is the suspect cases can be detected quickly after the symptom onset. So as you will find from a lot of the information coming through from the GPs in Ireland, is they need to get the results back within a 24-hour window. So all suspected cases should have test results within 24 hours, and then people have got to be effectively isolated should they actually end up basically tested positive, and that basically means quarantining them for the criteria. And the criteria that are utilized is that before you can go back into the public, if you're COVID-19 positive, you need to actually be 14 days from the very first date of onset of your symptoms, plus you must be 5 days fever-free. That did cause a little bit of confusion in the beginning because people thought that was 19 days. Well, it's not, because in a lot of the cases, the 5 days fever-free will also fall within that 14-day window. So the other aspect of the outbreaks minimized in special settings like health facilities and nursing homes. Nursing homes was a particular challenge, as we know, in Ireland, and continues to be a challenge in relation to this, and it comes around the testing. But really, the HSE is doing its very best to step up to the plate and come across and try and deal with that, and that's what they're hoping to have significantly under control by the 18th. There is some important cases from outside the country being measured. Now, some countries are doing this, as we know. China did that because they saw a rise. And if you were going to China right now, as soon as you came off, basically, if you could get there, as soon as you actually came off the plane, you'd be going into a local hotel at your own expense, and you'd have to spend 14 days, and you'd have significant testing there. A challenge for ourselves, of course, our close neighbour is the UK, where there unfortunately is a different protocol. And for a business to be operational, there is going to be travel between basically the UK and basically Ireland, and also, of course, between Northern Ireland and Ireland. So at the moment, there isn't the situation of actually talking about a 14-day quarantine, because that would be impractical, and you need to determine where you are in relation to the risks. I think that the sixth one is the most important, and the most important for all of us to consider. And this is our local communities educate, engage, and empowered, and to adjust to the new normal. So the new normal is, until at least we have a treatment, and potentially up until we have a vaccine, social distancing has actually got to be the norm. So I think probably what we might actually do at this point in time, maybe Fiona has actually run probably one of the polls there, basically. My apologies, what I might do before we run the poll, my apologies, I might go into just in case, I'm sure everybody has actually become aware. If you go on to the next slide, first of all, my apologies about Fiona. And this is basically the government's basically phased return. So we're talking about is obviously a 5-stage return starting on the 18th of May. And prior to that, in relation to cocooning, as we know, elderly people can actually go out as long as they don't actually make contact with anybody else and don't actually make contact with other surfaces. So you're talking about from May 18, construction workers, gardeners, allotment workers basically can return to work. Garden centres, hardware stores, electrical outlets, opticians, bike repairs, a lot of inference on the bike repair in the whole concept of the guidance in relation to the HSE, and outdoor sporting and fitness activities, tennis courts and golf courses can reopen, and outdoor public amenities and tourism sites may open. So that's basically May 18th. Assuming we don't go backwards, June 8th, strict social distancing measuring, of course, will remain in force and remain in force throughout all of this, as indeed with appropriate hygiene. And people will then be allowed to travel up to 20 kilometres from their home for necessary journeys. Over 70s will be allowed to shop at specific hours. And then basically visitor homes over 70s will be allowed, but only small groups and for a short period of time. Up to 4 people may visit another household for a short period of time. A slightly larger number of people can be in attendance at funerals, but they'll be restricted to immediate family and close friends. And this is actually obviously showing the huge mental impact this is actually having on everybody. Small retail outlets at that point in time with a small number of staff and open marts could also reopen, as indeed basically could libraries. Phase 3 on the 29th of June, cafes and restaurants will reopen with social distancing rules in place. Creches will be open, but only for the children of essential workers. Hospital and prison visits may resume. Business where employees have a low level of daily interaction may be returned. Phased reopening of non-essential retail outlets on the basis of restriction number of staff and customers per square meter. So again, social distancing can be maintained, which of course we're talking about as the 2 meters. Enclosed shopping centres will not reopen at this stage due to a higher risk, and playgrounds will be reopened where social distancing and hygiene can be maintained. Hygiene, of course, being a very important aspect of it. July 28, people can now travel outside their own region. A slightly larger number of people may visit another household for a short time. Small parties of family and close friends be limited to a maximum number of attendees for a limited number. Creches at that point for all other workers will reopen. Business will be asked to stagger work hours. Again, hairdressers and barbers may reopen. Caravan and holiday parks may reopen. And then phase 5, August 10, talking about pubs, bars and nightclubs and casinos will reopen, but will be socially distanced and cleaning will be absolutely paramount. Festivals and other cultural gatherings may be held, but with restricted numbers. Normal visiting will resume in hospital, and a phased return to work will start around that time, and shopping centres will reopen, as well as fairs and cinemas that can maintain social distancing. And then close vehicle contact sports like rugby, boxing and wrestling will then be permitted, and gyms can reopen. So looking at that part, which everyone no doubt has seen, perhaps we could actually maybe run the first poll, if you wouldn't mind, Fiona. I'm just checking if everybody can hear me.
I can hear you fine, Shane. Thank you.
Great. Fiona, would you mind running the poll? The first poll?
Yes, indeed. The poll is in progress. Attendees are viewing the question.
Oh, fantastic. That's excellent. That's great. Okay. So the purpose of this particular poll really is to try and get a sense as to the various industries and what perspective that we have and what percentage that we have in relation to that. And
I'll just give another 20 seconds.
Yes, perfect. And then what we'll do is that when we have completed that poll, since we want to give you all some work to do to make sure you're all awake, we'll also run the second poll as well once that poll is actually through.
Sorry, some people are saying they can't see the poll and some people are saying they can. So I'm wondering if you look on your top of your, if you move your cursor around the screen, and find the word polls beside Q&A, and perhaps you'll be able to access it there. Some messages coming in here.
Great, perfect. We can have a look at these as we go, and so let me see if I can. Okay, it's coming through there to me, that particular aspect there as well too. The only message I'm actually being able to access is that I can understand that basically one of people can't actually access the poll. But hold on a second, they're probably in the chat section.
Okay, I'm going to go back and we'll do it again. Now I've sent it out again there.
Excellent, perfect. Okay, basically, if you wanted, I think you had mentioned that there. I don't come across the actual questions. As you mentioned, they were. Let's see if I can.
Polls is up on your taskbar where you have your mute and your start video and so forth on the bottom of your screen. If 27 people have voted on the poll now at this stage, there's just a few left to go.
Excellent, that's great.
If we could, just a few more people there now, and we will we'll close it off in 20 seconds. 80% have voted now.
Excellent.
Okay, so we'll close it there. And I'll share the results.
Okay, perfect. Okay, so if looking at this, it would appear that basically 34% of our audience are anticipating that they'll be returning basically on June the 29th, and then 28% actually planning to return basically on the 18th. So okay, that's absolutely excellent. A small proportion talking about basically on August the 4th, on August the 10th. So obviously our talk about how we prepare business to come back to work is obviously appropriate. And then if it's possible, then basically if you wouldn't mind just running the second poll then as well too at the moment. The purpose of this second poll is really to look at, because everybody will have looked at their own ideas to thinking about what they need to do to get ready to come back to work, and is trying to get maybe a sense as to what pieces people have already actually looked at.
Sorry now, apologies for this.
No, it's fine.
Oh dear. Oh dear.
No, but if there's a delay on that, what I can do is I can actually go on anyway as people are looking at the poll and actually talk about the next slide and talk about what we're needing to do to actually prepare to go back to work. I'm sure the poll will still come through.
It will. Apologies for that now.
Poll
fine, 2. Here we go. I have it now. I'm very sorry about that. I can launch poll 2 for you now.
Excellent, great. Well, sure, maybe we might as well wait then till we get the results of that. So in that case.
So poll 2 is launched there. To reopen, which of the following do you feel requires to be in place? PPE, hygiene protocol, social distancing protocol, or certain safety statement for employees, temperature checks, appropriate clinical waste disposal, survey of employees to determine if they are in a vulnerable group, or all of the above.
Exactly, and then what you can do is you can tick them. You can tick all the above. You can tick 2 or 3 of them, whatever you think is actually appropriate. And they're not, I did the personal protective equipment is up there on the top, but they're not necessarily in any particular order.
55% have voted at this stage, so we'll wait a couple of more seconds.
Excellent.
$75. We'll go up a little bit further and we'll give another couple of seconds. And I think we'll stop there. We have a very good percentage there now, and end polling, and I will share the results. Okay.
Right, excellent. Okay, so the message basically of social distancing is 100% got across, which is basically great. Hygiene protocol has come through. People are actually talking to a degree about personal protective equipment, and then people understand basically about having a protocol. Temperature checks, a small amount, I'll discuss that. Appropriate clinical waste material survey. Okay, and it's interesting that 19% actually came across with basically all of the above. And I would hope that what will happen is that at the end of this presentation, that everybody will actually understand that all of the above is actually what is completely appropriate to ensure that we maintain the whole place, the home environment safe. Okay, so maybe if we could go, that's very useful. If we could go on to the next slide, which is basically guidance on how to prepare basically the opening. Okay, so the first thing is, like any risk, it's actually about a risk assessment. And I think the most important part of that is that all organizations, of course, will have their health and safety statement. And there's a good time to actually dust this down if it's actually on the top shelf or if it's actually hidden away in one of your hard drives, and actually amend it, because you really do require to go through the principles, go through your safety statement, regardless of the size basically of your industry. And you need to actually end up updating this in relation to COVID-19, because only by doing that you become fully aware of all the aspects that are required to be done. So the first part is in relation to a health and safety statement. That's the first get-go on this. Then what you need to do and to incorporate basically into this is develop an infectious disease preparedness and response plan. And then that plan should consider and address the level of risk associated with various work sites and the job tasks workers perform at those sites. You need to consider where, how, and to what sources of COVID-2 might workers be exposed, and that includes the general public, customers, and co-workers. You need to consider sick individuals. You need to have a protocol in place to ensure someone who is ill does not actually return basically to work. You need, in the healthcare setting, I know we've got a number of organizations that have joined Safe in the Healthcare, they need to have basically make certain that if they've had an unprotected exposure, that is actually addressed, be it basically in their work or in their home environment. And then the work's individual risk factors have also got to be included as well. And one of the things that you see at the end I've referenced is basically I've put together basically a COVID-19 19 basically point checklist, which you might utilize to consider, and that'll be easily accessible and downloadable from my website, which is a link to on the final second from the last slide. And then basically the 12-point plan to ensure employer readiness. And it's just to try and make sure that we tick off all the points and go forward. So if we go back in relation to the hierarchy or the principles basically of any kind of ensuring of a workplace being safe, we talk about the hierarchies of control. And occupational health and safety hierarchy of control is always going to actually be talking basically about, how do we prevent the hazard if at all possible? So what you're talking about is first piece in the hierarchy of controls are engineering controls. Excuse me. So an engineering control is involved isolating employees from a work-related hazard. Typical example of that in a chemical factory is you actually put an engineering solution so the employee cannot get exposed to the particular chemical. These types of control reduce the exposure to hazard, and they don't rely on worker behavior, and they are, of course, the most efficient solution to implementation. So engineering controls basically for COVID, we're talking about, and this would be depending on your industry, so high efficiency air filters, so we're talking about going back into areas of high risk like the dentist, increased ventilation risks, ventilation rates, installing physical barriers such as clear plastic sneeze guards, potentially installing a drive-through window for customer service, and then negative pressure ventilation in some settings, like for example the dental area where you're talking about aerosol generating procedures. So that are essentially the engineering controls. The administrative controls, and they do require action by the worker or the employer, and typically the administrative controls are changes in work policies or procedures to reduce or minimize the exposure to the hazard. And as you can see, that is why the safety statement is so important, that you do it and that you pass the information on to everybody. So the key aspect of that is you encourage sick workers, they must stay at home. You minimize contact about workers, clients, and customers, and you do that by social distancing. You establish alternative days or extra shifts, that way to hopefully get your business operational, but the question is, can you roster people in for a shorter period of time? That may plan extending your business hours if you actually are in the manufacturing areas so that you can actually have lesser people in and maintain social distancing. You need to provide workers with an up-to-date education and training on COVID-19 risk factors. So provide them a source. I think it's a good idea in your protocol that you say, look, this is a source you go to get the information, because there's so much negative information and incorrect information on social media, and a link to the government basically website is absolutely the way to go. And then you need to train workers how to utilize protective clothing. As I mentioned earlier, if they are going to wear PPE, they have to cover their nose. Interesting point on that part is a person's wearing a face mask. They're going to the canteen. You're implementing social distancing, so people are 2 meters apart, but they have to take the face mask off in order to actually have the food. They don't leave the face mask on the table. One simple process is they get one of a simple Tupperware container. And what they do is they first of all invert the lid, put the mask on the lid, put the ear components around both sides, invert the lid again and close it. Now they've actually got their mask in a sealed container. When they are going to remove their mask, and then the general recommendations about this, again available from my website, is you're talking about you should change it basically every 4 hours, or if it actually gets damaged. So training is a key important aspect in relation to this, so people understand the whole process about hygiene and about social distancing. In relation to surfaces, initially they were thinking that COVID-19 might on some surface last up for 9 days. Information now you're talking about probably 72 hours is the maximum. We also know that if you cleanse the surface within 1 minute, the actual COVID-19 has been eradicated, and the transmission rate basically from a surface is significantly less. And maybe this might just bring me back to the process in relation to when we spoke about the masks earlier. If a person is very infectious, and of course they shouldn't be at work, and if they're coughing, then the thought was that it would actually go out to a level of 2 meters. Information that's come through from the CDC would now suggest that that 2 meters actually might be not correct. It might go slightly further than that. And that's why the CDC is advocating that everybody should wear some form of face cloth protection. However, if you're asymptomatic, how you actually are going to spread that in general is going to be through droplet secretions as you're talking. Droplet secretions as you're talking, of course, are not going to go the same distance. So therefore, if you are wearing the face mask, that's actually going to end up giving you a level of protection. And of course, hand hygiene is, again, absolutely and completely essential. One of the things that people need to consider when they're talking about social distancing is, and again, as part of the checklist point, is how do you actually end up basically making sure you don't have 2 people in the elevator at any one particular point in time? How do you maintain social distancing in the restrooms? These are all considerations that people need to actually be thinking about when people are actually coming back to their workplace. The next component then that we are talking about basically is safe work practice. So,
sorry, Shane, could I interrupt you, please?
Yeah. Yes.
We have a question.
Good.
Okay. So the question, I have a question about reservation requests from USA guests to book in for B&B accommodation in September. Do they need to quarantine on arrival? Therefore, should we be looking at accepting international bookings or not?
Okay, that's actually a very good question. If you look at the actual criteria in relation to the WHO, what they actually are stating basically is that they should actually have a sort of a contact tracing, and that will therefore depend basically on, would that be up to 14 days? It would have to be. Now, to date, the government have not actually said that we're going to actually isolate people if they come into the country. So it's going to really depend on the country. So if you're coming potentially from a country that's got a very high level of cases, and if at that point in time come into August, what basically is happening is that our RO level has gone up and we've had to go back a step or a number of steps, then I think you're going to find that the guidance from basically the chief medical officer would be to start looking at people coming back into the country. So there's going to read, and it's unfortunate a question you can't give a definitive answer, because it's going to depend on what the replication rate is of that country, and basically what the risk is in Ireland when they have opened up and allowed more people actually coming in. So at the moment, they're not talking about going down the road. So I will be thinking that in terms that if I think of Portugal, where I'm currently resident, they have actually made a decision here in Portugal that what they're doing is they're opening up the hotel industry from August. Now they're going to put social distancing onto the beaches, but they are going to open up the hotels at that point in time. So working on that principle, Portugal very similar basically to Ireland in its approach and how it's managed to control basically COVID-19. So I would think if it's August, a policy would be worthwhile considering accepting that particular booking. So if I go on then basically to the next part that we're talking about here is safe work practice. My apologies, the same slide. We go back again to your slide. Sorry about that, Fiona. So on safe work practice, we're talking about safe work practice are types of administrative controls that include procedures for safe and proper work use to reduce the duration, frequency or intensity of exposure to a hazard. And in relation to COVID-19, examples of this would be promoting personal hygiene. So you're talking about no touch, basically bins, hand soap, alcohol-based hand rubs, constant hygiene in relation to washing hands, regular hand washing, posting hand washing signs everywhere, ensuring social distancing, that both, as I mentioned, relate to elevators, canteens, and washrooms. And again, the key component of this as well, too, around social distancing. If your organization is such whereby you have a clock-in system, there should be a line on the ground, 2 meters. People stand behind that line. On the door, it should be, if you have got the following symptoms, please do not come to work. And the symptoms that would actually be considered to be appropriate would be if you have a fever, if you have a cough, if you have a respiratory symptom of any shape or form, or if you actually end up having sort of shortness of breath, you just don't come into work. So you're reading that, you go home. You shouldn't be coming in anyway, but you go home should they happen. And when you clock in, you ensure that you actually have that social distancing piece maintained. The next part then is, of course, into PPE. And in general, they will talk about personal protective equipment as a last defense. So if you talk about an organization that's working with chemicals, you do your very best to eliminate the risk by using to a substance that isn't hazardous. That we can't do. You can't eliminate the risk. You go with your engineering control, your administrating control, your safe work practice. And with all of that, if there's still a risk, then you go with the PPE. And an interesting part that actually has come back is that a study done basically completed basically by the CDC is suggesting that if everybody was to actually wear basically PPE, in other words, wear basically the face mask if they're out and about in the community, that they could potentially reduce the death rate by as much as 60 to 65%. Now, again, it's constantly changing, but that's the key aspect in relation to looking at the issue about face masks. And I think that's actually going to be something that's actually going to come back in. So I think maybe if I then just basically look at ensuring employee readiness on this, and again, you can download this, as I mentioned at the end, is important that you actually have 12 points. A clear statement and protocol needs to be in place. And that's we're talking about the health statement. Full race-based identification of vulnerable employees, social and physical distancing, ongoing resource testing program. So you're talking about that, we're talking about that. If you're in a situation where you think somebody is potentially positive, you do send them home and they don't come back until you have got clarification that they're safe. A comprehensive data protection plan basically is an important aspect as well too. Consider family supports for employees who test positive. For planning of the appropriate PPE, so that needs to be risk-based. Additional resource and a protocol be needed for a high-risk common touch areas to be cleansed and disinfected, which really means actually reviewing the contract that you have with your provider to provide the wash down of the areas. Interesting concept about mass temperature screening. Now that's being shown to be only partially effective, because the issue about temperature screening is that if you're asymptomatic, you're not going to pick that up. It does give a high level of optical piece, but if you're going to do it, you really need to make sure that you maintain social distancing. The issue about that for smaller business in particular, these machines are relatively expensive. I've heard costs of between 5,000 and 7,000 euros for these aspects. And you're talking about, you need to get, if you're going to use temperature screening, it needs to have what they refer to as a negative predictive value of 99%, which means a 99% chance accurate. And basically, survey all employees to determine basically where home or remote work is feasible, and business travel or then direct customer contact basically should cease. And of course, making sure you maintain social distancing. And then there is a checklist, and I won't go through all the points of that, but there is a 19-point checklist at the end of the day to give you an indication basically as to making sure that you have covered this off. And if you have, I think you've done everything you possibly can to allow your employees to come back to work and to ensure that your customers are safe. I know it's a lot to cover, and I've gone over time on that particular component of it. I don't know if any other questions have come in on that as yet, or maybe those questions will come in towards the end, Fiona.
Yes, we have two questions.
Okay.
The first question, what would you recommend for cleaning / disinfection of soft furnishings that cannot be removed? Example, seat coverings.
Okay, so I think what they're talking about really again is that it's really about the products that will actually end up getting rid of the virus. So you are talking basically in relation to 60% alcohol base, but in relation to cloth furnishings, the risk of coming through from there is less. So if you take it back to your simple clothes, so putting your clothes into the washing machine will eradicate it. So if you're talking about in relation to cloth coverings, two aspects might be for consideration is that one, that you cleanse it with a normal cleansing solution because that will eradicate the virus. And secondly, whether you might consider putting on some form of a protective covering over that cloth covering so that you can ensure it can be wiped down on a more easy or regular basis.
Okay, and the next question then, please. Given the WHO guidelines of 1 meter for social distancing as opposed to the Irish message of 2 meters, do you think in restricted premises such as hospitality, bars and restaurants, that perhaps the guidelines may accept, say, 1 meter between, for example, the backs of 2 chairs facing away from one another? In instances where the spaces can't be met, sorry, I'll leave it at that first of all. We go that.
Okay.
So do you think that the guidelines would accept, say, 1 meter between, for example, the back of 2 chairs facing away from one another?
Okay, I think the answer to that question is no, they will not. And I think the issue that we've actually got is that recent study that actually has come back has shown that if a person is in a situation where they are infectious, that there's a possibility that droplet spread would actually occur outside the distance basically of 2 meters. One thing that is a potential consideration would be that if you had a screening program where you could ensure that nobody coming onto the premises was infective, so in other words, their criteria are that they are not actively infected, they don't have a fever, they are not basically coughing, they don't have a respiratory symptomatology, and they're all absolutely wearing some form of face cloth protection, then you're in a situation where they may actually consider potentially the 1 meter piece. But there's an interesting part that, and again, there's a link to it on my website, where they're talking about looking at the droplet spread in a supermarket setting. And people may have seen that. If not, certainly go into my blog and you'll see that. But the interesting part of that, the diagrams in that show that you're walking on an aisle in a supermarket. Somebody is walking on an aisle in the other part of the supermarket. One person on the aisle, neither are wearing masks. The person on aisle 1 has COVID, is symptomatic and coughing. It has shown that the person in aisle 2, despite of that level of barrier, can actually contract it. And the other aspect is that why the CDC are now pushing the fact that people should actually wear cloth masks is because they feel that if somebody's infectious, that it may go beyond the 2 meter mark. And the other part is you're talking about an instance where the spaces can't be met, will it be reasonable to suspect that a physical barrier such as perspex between booths or tables will provide? Yes, I think that actually is a good aspect, because that is something that is actually being brought in basically within office environments, or indeed I provide a lot of support to the pharma industry, and there's a situation where on occasion you've had to have people actually in close proximity, and in that particular aspect has been acceptable to put perspex between. What you need to do though is to ensure you've got an excellent hygiene protocol, and the question really is, if you've got a lot of turnover, people coming in and coming out, who is going to be responsible for cleaning down the booth? Unlikely the customer, but maybe what you might do is leave actually your cleansing agent there in that particular station for them to look at basically utilizing this, and have a very regular aspect where you actually have a very regular cleaning program. I do really think they're really going to be pushing significant hygiene, and looking at the hotel industry in Portugal, they are really focusing that hotels must actually have very robust hygiene protocols to allow them be considered to reopen. A lot of thought had gone back before us about whether the HSA would police this, because in the UK they were talking that the HSE might inspect properties prior to them opening. That's not going to happen with the HSA because they don't actually have the resources, and the HSA role will remain. And if there's actually a concern or an issue brought up, that what they're going to do is they're going to actually evaluate you at the end of that, which of course will be virtually in the first instance. Basically, for serving food to guests and cleaning their plates, I would suggest that we do this. Okay, so what you're talking about there is that, again, you're talking about the probability of actually contracting basically it from a surface is quite low. So if your staff are wearing gloves and they are collecting the area, simple washing of the plates will eradicate the virus. So that is how you would actually would do that. So that's, for example, what the Meals on Wheels people are actually doing, currently bringing supplies to the elderly. Okay, so
could I ask a question?
Of
Shane?
Course.
I'm just interested, when you were back responding to the one there about the restaurant and the hospitality, the bar and the social distancing, 1 meter versus 2 meters, and you made a comment there, you know, about if you had the screening and some sort of face cloth protection. But how does one dine in a restaurant and drink in a bar with a face cloth protection?
And that's exactly it. So I think in relation to the bar aspect of it, I don't think they're going to make any opportunity at all of restricting it to from a 2 meter to a 1 meter aspect. I think they're going to really go with the 2 meter aspect when you're having a meal, because if we talk about going back into the workplace and you're going to the canteen, the criteria will be that if you are going to the canteen, that you must be sitting 2 meters apart from somebody else, because you can't wear your mask in that situation. So in relation to the hospitality center where you're physically in the restaurant or taking a drink, I don't see the 2 meter piece changing.
Thank you.
Okay, so what we might then basically do, because I want to just very briefly cover off on the mental health piece, and I know if we're still okay on the time, I might just basically just run that last poll, if we can.
What percentage of your employees do you expect to have back on day 1?
Yes. Okay. That poll for next. Yes.
Poll is open.
Excellent. I do know it's actually an awful lot that we're trying to actually cover, but hopefully the final slide will give people access to a lot of the resources. And also, of course, if people have any particular questions, don't hesitate to actually send me an email, and I'll certainly do my best to actually answer those for you.
Okay, another 5 seconds. We should have everybody. That's it. We close the poll.
Great. Okay, so that's actually interesting. So we're talking about that the mean that we're looking at basically here is that 32% actually feel they'll actually have 40% basically of their employees back. And you know, and why it's important to run this poll now is because people are very aware of social distancing, and indeed in the earlier poll, they're aware of that particular side as well too. And I'd imagine that what you will probably find is that the different levels of the numbers will absolutely reflect the interesting where people are at. It's interesting to see basically where on day one that basically 19% anticipate that they'll actually have 100% of their staff back. And that's an interesting aspect, and hopefully that's going to be the case. But obviously, it's a question of making sure that the protocols are in place, because we all have a responsibility to ensure that we don't actually go at this too aggressively, so that we end up having to go back a stage or two. So that's the key. That is the key message in relation to this. Okay. Do we still have a little bit of time to go on to
Have a
briefly
question,
outline the
please.
mental health piece?
We have a
Go.
question, if that's okay. Why,
Yes, of course it is.
why do you think dentistry, which you stated is especially challenging, has had so little guidance from government level?
Yes, okay. And I really do think there should be a lot more guidance from this. I think the big difficulty that we've got from the point of view of the dentistry is because it's aerosol producing, as we all know, if anybody's been to the dentist, of course, they have a filling. I know that in the UK that the head of the dentistry is trying to give some guidelines, but they don't seem to be very practical. I have a little bit of information around this because a colleague of mine is actually a dentist across over in the UK. You know, they're debating about, you know, if a person needs to have a filling, does that mean they go into a hospital? The other question that basically comes up is, you know, how are you going to completely decontaminate? You can, okay, with a variety of controls, and you're talking about potentially the dentist having to wear an apparatus where they actually are getting basically air into their system, and they're completely protected, and where that become uncomfortable, the question is then going to be is when the individual comes in, you know, how do you do the deep clean in between each of these cases? And the question is that, you know, say if, for example, a normal filling might take 40 minutes, and then something with a deep clean, this is going to take maybe an hour and a half to 2 hours. How do you cover that from a cost perspective? And I really do think that the government is going to have to address this. And I would be thinking that it's important that you would get the lobbying part of your dental organizations to actually put that piece into place, because we can't all really wait to get dental treatment until such time as potentially there is a cure, which may be 6 months down the road, or indeed basically unveiling of that adequate vaccination. So it's very challenging. I really do think that the dental community have not particularly been served about enough on that. So it's about lobbying, I think, in relation to it. Now, what we might just then basically do is I will just go briefly through just to touch on the other aspects. So we go back one slide and just run the last poll. Thank you on that, Fiona.
So the poll is, what do you think are the warning signs that your remote employees are suffering from stress? What do you think are the warning signs? So we launch the poll.
Fantastic. I think the importance basically of this, and it's going to be, I suppose, an issue as well. We need to make certain that we protect our employees, and of course, where we want to get back to work, we do understand that a lot of people would simply be afraid to go back to work, and they may have vulnerable people in their household. And the question is, you know, this is something that Adrian covered in his webinar last week. What happens if you've got a person who's afraid to come back, but at the end of the day, they don't have a medical condition and the work is available? And the question then is, this of course a legal question obviously, is, you know, can they actually avail basically of the COVID-19 various benefits? And I would suggest they probably can't, because work is actually available to them. But it is important that we get a sense as to how do we, as owners of businesses, as employers, as managers, pick up if our people are under pressure, and what can we do to help facilitate them.
Okay, another few seconds and we'll close the poll.
Thank you, Fiona. That's great.
Thank
and
you.
my apologies for running so much over time here on this.
Okay. So we share the results.
Okay, well, that's excellent. So and that's actually, so 77% have basically said all of the above, and that's absolutely perfect. It's interesting that people are aware of employee language becoming basically negative, employees making mistakes, and then decreased resilience, and both those running at 17%. So if we can very briefly then go on to the last slide. Now we're very near the end of the presentation. I do apologize, but I will go through this quite quickly. So the warning signs we're talking about are the three of them: decreased resilience, employees making mistakes, and employees' language becoming more negative and emotional. And to give you an example, basically of decreased resilience, so resilience is basically the how we actually would deal with adversity and how we can react basically to criticism. And what will happen there is people will, if they got decreased resilience, they'll have difficulty concentrating, they'll loss of interest in things they would normally enjoy, they'll feel hopeless about their future, they'll feel distant or cut off from others, and they'll feel quite irritable or angry. Then looking at employees making mistakes, again, you'll actually will see is that what's happening is that they're inaccurate, they become late to actually start the work process. And essentially at the end of the day, you're going to notice that they're going to get forgetful. So you give them tasks to do, they don't actually complete them. So again, that is also a warning sign, particularly if this is different to what that particular employee's behavior had been before 1 month ago. And then you're talking about employees' language become more negative and emotional. So they'll be talking about giving a project and they're coming back to you and say, there's no possibility out there of finish this project in time, whereas before that wouldn't actually have been an aspect for it. And it's very important that, they're saying there's nothing I can do, there are no other options, I can't do anything. This is completely an impossible task. So there are the aspects that are put forward. And when you pick that up, what you then need to do is to make certain that you don't take ownership of their mental health concern. Because as a non-professional, what you're doing is you're picking this up. So you're advising them to go to your employee assist program, should you have one. Should you not, one of the resources at the end of this is a very good resource basically from the HSE, where it actually talks about the various way people can access supports basically in Ireland through support of their mental health. And these supports are free. And then if the person seems to be a little bit more complex, they've had a past history of some previous problems and they disclose that to you, then you ask them to go back to their mental health professionals or to their GP. And again, despite the fact that we're in COVID-19, I think what you do is that if you find that the issue is a significant health issue, you bring it to the attention of your HR department, who will refer this on to your occupational health assessor to actually help give guidance about what supports can be put in place and the person's fitness for work. And then if we could just then maybe go on to the next slide to look at basically protecting your mental health. So really the key aspect of that is recognize the symptoms of stress. And I think the way to simply look at this is it's the equivalent of maybe back in pre-COVID when we may have been going around to a number of businesses and maybe had a cup of coffee at every stop and had no breakfast. So the equivalent of having 3 or 4 double espressos in our system before lunch. And it gives you a physiological sap. So you get increased anxiety, you feel irritable, you feel stressed, you're constantly checking yourself for symptoms, you become more irritable, insecure. Aches and pains, you think, God, are these related to the virus? You have difficulty sleeping, lack of control, stomach symptoms, irrational thoughts. So these are all the symptoms that you get if you actually are suffering from that. And I think the important aspect of this is that if you actually are having, stress-related symptoms, then obviously access the EAP service. Important aspect to protect our mental health is we just stay informed, but set limits for news and social media. So once a day, and that's why I think giving guidance to our employees to include a reputable website like the HSA and link that for the guidance. Important if you are working from home and with people coming back, there's probably still going to be a rostering piece where people are still going to work from home some of the days per week, to actually get dressed. Maintain a regular schedule. So don't be in a situation whereby you're coming across and you are, basically working late at night and not early in the morning. Separate the work and home areas. So you've got a designated area in the house where you go to for your work. And even if that's a different corner of your sitting room or a kid's bedroom or something, use that. important to stay social and remain connected to others. And when you can't do this basically by meeting people as you might have done before for a coffee, I think it's important that managers would set up some time on a WhatsApp group or something where they don't talk about the work and they just talk about where they are, talk about the local interests, talk about the politics, talk about whatever it actually might be. Keep up healthy routines. So daily exercise is very important. And I'd be a big advocate of exercise twice a day, again, within the constraints basically of social distancing, but getting out for even a 10 or 15-minute walk first thing in the morning before you start your day and last thing at night can absolutely be very helpful. And then obviously then eating healthy. That's actually a very important aspect for us. And people have got the opportunity to potentially eat more healthy when they're working from home than if they actually are out and about and they're just stopping for a sandwich basically as they go along. And then if we just go on to the next slide then, if you wouldn't mind, Fiona. Okay, so these are basically just the links that I've actually have put. So again, when you click on those particular links, and I do understand that Fiona is going to make this available or even this page available to people should they request it, you will basically get an outline. So that will actually link you to the most up-to-date aspects. The issue on the mental health, which I've gone through very quickly, and it's only because we're limited for time, but there may be another aspect to talk directly about mental health, but information about struggling with stress and protecting your mental health, they will bring you directly into the HSE websites. And then if you actually link into the final web page part there, that will bring you into the component of my website, which actually has the various protocols that I actually have referenced and absolutely they're in PDF format. Just feel free to download those. And then just on to the next question there. Next slide again, which I think should be the end. Okay, so it's really just the question then of seeing basically if anybody has any additional questions. And I know I've actually gone 8 minutes over.
I'm just going to read from a message in chat here. It was in response to an inquiry there about what cleaning solutions to use. It's important that we look after our own during this and try and spread the word of hints and advice to each other. So one of our attendees has said that they deal with a Wexford surface protection company, NP Liquid Glass, Rachel Murphy.
Okay.
Rachel has worked for the Royal College of Surgeons to protect the furniture in canteens and rest areas. So it's just an option. There are lots of other providers, but there's something local in Wexford.
Excellent. That's fantastic. And I think really it's a question of sharing amongst the community and sharing basically amongst your community of chamber members, because you find a solution and then provide that solution basically going forward. Because obviously what you're trying to do is in a situation whereby you can maintain your upholstery and at the same time be in a situation where you prevent the infection piece as well too. I think the important aspect though about this is that it is really about spread from the hands, hence the hand washing, and spread from the droplet secretions are the main. We absolutely need to focus on the hygiene, of course, as well, but it's more basically about the contact surfaces. The risk is higher from that than it would actually be from sitting down in a chair where somebody has previously sat who may have COVID-19.
Just to go back, we have another suggestion. Michael here from Bang Promo in Wexford, supplying our clients with sanitizer, gloves and masks, all WHO standard, sanitizers over 80% alcohol level, viewable on website.
Fantastic, and that is absolutely great.
Could I just say, we are gone a little over. Dr. Shane Farrelly, I'd like to thank you very much. That was a hugely informative presentation. On behalf of County Wexford Chamber and Wexford Chamber SkillNet, I would like to thank you for your time. I have a few takeaways. One is that a research, as of the 3rd of May, said up to 82% of people could be asymptomatic. Dust off your safety statement that cleaning within 1 minute can eradicate the virus. Access supports, look after your employee and your own mental health. And if you have a screening program and some sort of face cloth protection, we're on the journey to returning to being able to restart our integration into society. So Shane, thanks very much indeed. Thank you all for joining us. I'd be delighted to share this presentation and to share answer any questions. And obviously those two handouts which Shane referred to, the checklist and the and the checklist and the readiness point plan, we will have both of those available for you. You can email us or we'll put them up on our website.
Fantastic, and thank you so much, Fiona, and thank you all very much for your time.
So, Liv Galair.
Slán.